Temporomandibular joint disorders, or TMJD, are a group of painful conditions that affect the jaw joint and surrounding muscles and nerves. Although TMJD is not life-threatening, it can be detrimental to quality of life since the symptoms can become chronic and difficult to manage. Every day, millions of people worldwide suffer from TMJD pain and associated symptoms, such as grinding of their teeth and headaches. Published research from Europe, the United States, and Canada indicates that a significant percentage of the population, up to 25% of adults, suffer from oral-facial pain associated with TMJD. The condition affects both sexes, but women tend to experience the symptoms more than men, especially jaw pain and grinding of the teeth. Younger people tend to suffer from the disorder more than older people. A variety of symptoms are linked to TMJ disorders. Pain, particularly in the chewing muscles or jaw joint, is the most common symptom. People with TMJD can also experience jaw muscle stiffness, difficulty chewing, limited movement, locking of the jaw, grinding of their teeth, or headaches. Treatments for TMJD range from simple practices, such as eating soft foods and taking prescribed pain medication, to wearing a bite splint, to more extreme treatments such as arthroscopy and open joint surgery. One of the most traditional forms of treatment has been to prescribe a bite splint. While bite splints have helped to reduce TMJ pain and the grinding of the teeth, there are drawbacks with these devices. For example, they cannot be worn while eating, and they also affect speech, and as such are typically only worn at night while sleeping. There is a better solution. The Cerezen TMJD treatment devices are patented medical devices that treat the TM joint at its nearest access point, the ear canal. The Cerezen devices are two custom-made hollow ear canal device inserts that permit full passage of sound and provide comfortable relief for TMJD sufferers. The ear canal naturally changes size and shape when the mouth is opened through movements such as chewing and speaking. The Cerezen devices use this anatomical change to provide a unique near-field treatment for TMJD. The Cerezen devices can be up to or greater than 20% larger in their dynamic geometry than the ear canal when in a jaw-closed position. It is this change in volume or ear canal space that is believed to provide joint support as well as a unique cognitive awareness mechanism for the patient. The Cerezen devices are made in 3 basic steps. First, the patient is examined by a healthcare provider to diagnose TMJD. Then, the Cerezen devices can be prescribed. Once the examination is completed, an impression is made of the patient's ear canals. The impression of each ear canal is minimally invasive and can be performed by the healthcare provider, or the patient will be directed to a local certified audiologist. The entire impression process typically takes less than 20 minutes. The ear impressions are then used to make the custom devices, which are sent back to the healthcare provider in approximately 2 to 3 weeks. The Cerezen approach provides a simple, non-invasive, near-field approach to reducing the pain associated with TMJD and/or grinding of the teeth and headaches. The inserts can be worn 24 hours a day and do not interfere with eating or talking. Most importantly, the Cerezen devices are an effective solution. Studies have shown a significant pain reduction for those who have it. In addition to the pain reduction, 100% of subjects indicated good or excellent overall satisfaction with Cerezen devices. Cerezen, comfortable relief. Refer to cerezen.eu for more information. When the devices should not be used, contraindications. You should not be fitted for Cerezen devices if you have active ear drainage, swelling, or redness, you have an unresolved history of ear pain unrelated to TMJD, or your ear canal anatomy does not allow for fit of the devices, for example, too narrow or prolapsed or fallen canal or previous mastoid surgery. Risks and benefits. Patients wearing the Cerezen devices in a 3-month clinical study experienced a significant reduction in the pain and dysfunction associated with TMJD, to an extent at least as much as that experienced by patients wearing a stabilization splint, mouth splint, or following a specified jaw exercise regimen. No unexpected or serious adverse events were reported, and a comparable safety profile to the stabilization splint, mouth splint, was observed. Patients in the study reported very high levels of satisfaction. Refer to cerezen.eu for more information.